Hello students, I am the OGGuru Dr. Punit Bhojani here with a single point agenda to make OBGY your most favorite subject, most scoring subject. Now in this very important video, as you know, around roughly 6 months remain for the NEET PG 2026. The date tentatively announced is 30th August. So I am here to give you the final 6-month strategy. What should you do to crack the NEET PG? Feel free to get in touch with me on phone and WhatsApp on this number. Stay till the very end. It's a very important video. I'm going to tell you regarding all the 19 subjects, which to follow, how many days to give, how many grand tests to give, and how you can boost up your score. Okay, so this is going to be a detailed strategy video. And before we proceed further, download the OGGuru app with all the brand new content, and OBGY will become your most strongest subject and most favorite subject is my guarantee. 20 to 22 MCQs come in OBGY every year, and every year students tell me that sir, all 20 MCQs were from your video lectures. So whichever source OBGY you studied from, don't worry, just enroll in this app. I'm personally guiding all the students how to study, how to prepare, and you're going to get beautiful theory lectures, MCQ discussion videos, image-based questions with all the recent advances. So download the OGGuru app and quickly subscribe to the Masterclass NEET PG 6 months validity. Now, avoid doing this mistakes. What many students feel is, as I know many of you would be giving it for the first time, your internship might still be going on and you feel that the time is less. Many of you will be giving it as a second attempt. Point number one, even if you haven't started your preparation, do not panic, but you need to start. You need to start your preparation right away. That's the most important thing. If you have been going slow, then boost up your preparation. Mistake students make is that they directly go and attempt the grand test. No, I will tell you when should you attempt the grand test, how, and do not also directly go on RR topics. Okay, RR you can reserve it for the smaller subjects or the less important subject. The main subjects which I will tell you which are the most important subject, the scoring subject, you need to go with the detailed lectures in the first 3 months, this next 3 months, because absolutely remember student, it is a concept based exam. Gone are the days of one-liners. You are going to get proper clinical cases, and only those students, as I tell in my lectures, hashtag crystal clear concept. It is very clear that only the students who are going to have crystal clear concepts are going to crack the NEET PG. So you need to build up concepts, because conceptual MCQs are coming where you have to apply your brain. Long clinical questions, IBQs are going to come for you. Of course, it's going to be a balanced paper, so don't panic, but please focus on the concept first and do not directly attempt for RR and grand test. Again, the common mistake is that medicine is very huge and student directly start with medicine. No, I'm going to give you a trick and shortcut for medicine. So please continue listening to this till the end. Medicine is very huge, and if you start it directly, you're going to waste a lot of time. So I'm not saying that you don't study medicine. Of course, you will focus on medicine, but when, how, all I'm going to tell you. Do not, as of now, plan to skip any subjects, not even your smaller subjects. And then if the time is lesser, which are the subjects which you can skip and all that I will tell you later on. But as such, do not skip any subject completely, not even the short subject. It's very important. And overall, we will be telling you to attempt 10 grand tests over the next 6 months. In the next 6 months, we'll be giving 10 grand tests. But most important part is analyzing the grand test results. Your score is only going to improve only when you analyze the grand test, which again I'm going to tell you. Now, please pay attention. How does the strategy begin? The strategy is that phase 1, phase 2, phase 3. The phase 1 is the most important. Next 3 months is going to decide your rank. Next 3 months are the most important phase. So this phase 1 is the most important phase. And as you know, we have got roughly 185 days for the NEET PG exam. 5 days buffer I am keeping, because few days your health will not be good. Some days you will waste in your some other duties and all that stuff, and other doing work and all that stuff. So 5 days buffer we have kept, and overall we are going to give you the 180 day or the 6 month strategy. Now in the first intensive phase, which is starting from Feb 26, the phase 1 which I call it, we are going to focus on the core concepts. Core concept means the detailed theory lectures, the detailed explanation, the detailed notes, and in detailing as much as you can go. And what are we going to do in this phase 1? In this phase 1, the timing 10, 12, whatever maximum hours you can put it in a day. Try to put in 10, 12, 12 hours at least. In this phase 1, 75% of your time you should be dedicating it to theory. By theory, I mean theoretical concepts which you will give, your most important topics, detailed concepts, and remaining 25% of the time will be dedicated to MCQ. So in the whole day, if you're studying at least 10 hours, 6 to 7 hours will be going for theory and remaining 3 to 4 hours will be going for MCQ. So theory, you should target to put in 7 to 8 hours and another 3 to 4 hours you try to go in for the MCQ discussion. Okay, try. I know those who have internship and heavy duty will be difficult, but this is what it is, what best you can make out for. So in the phase 1, if you understand this, that phase 1, the more concept is on theory and the concepts, and little bit part is MCQs. Why? Because phase 2, phase 3 is going to be completely majority MCQs. So we will not get time to read the theory part. Okay, so in the phase 1, which is the next 3 months, how days you are going to divide, all that I'm going to tell you, which subject to give, which importance, all that will tell you, and overall roughly 3 grand tests you attain. When the phase 2 starts, phase 2 is your revision 1, the first revision. The first revision is your phase 2, and your final revision R2 I am writing. So this timetable, the 6-month strategy gives you 1 complete reading. It's the 1 main reading, as you can see, 1 main read plus 2 revisions. This is absolutely good enough to help you crack the exam because you're getting 2 good revisions also. Now the second phase, which is the 2 months, lasting for 2 months, we will try to attempt to give 4 grand tests. Here what we are going to do is we are going to do PYQs and your MCQs and theory of the weaker topics. That means what will happen from phase 1 to phase 2, if you understand, the whole ratio will invert. Now your 75 to 80% of the time will be spent in MCQs only. And then whichever MCQs are going wrong and which you are making mistakes, from your mistake, the remaining 25% time will be going to be in your theoretical concepts. Still theory you will have to keep on revising because of the weaker topics. So which you are making mistakes, which topics are going wrong, which topics are weak. Yes, again, there is no option, but you will have to go and do the theory part. So I hope it is absolutely clear how the phase 1, phase 2, the whole thing changes. It's exactly ulta and reverse. That's why in the phase 1, we are going to spend a lot of time in getting the concept stronger. And of course, MCQs daily, you will keep on doing MCQs and analyze them also. But as soon as you enter the phase 2, the entire ratio will change and then more focus will be on MCQs and the PYQs and the topics, because topics every year definitely repeat. And then whatever are going wrong and mistakes and weak, uska theoretical part you will be doing. And the final revision, which will be the last 1 month, where we will give 3 grand tests, so total of 10 grand tests, and the last 1 month will obviously be 100% MCQ based, where you keep on doing the clinical MCQs, most important IBQs, and repeated topics ka MCQ. 5 days buffer we have kept. Now, when you look at this phase 1, which is the main concept, and this is going to discuss your rank. Now, please understand this. All this is as per the weightage of marks. 200 MCQs ka pura game hai. The whole game is of 200 MCQs. The big 4 for any exam, the big 4 subjects, the big 4, whether it is your INICT or NEET PG, the big 4 is your medicine, surgery, OBGY and PSM, your majority paper. Why? Medicine, expect around 20 to 25 MCQ. Same thing, surgery 20 to 25. OBGY, every year, my dear student, 20 to 22 MCQs are going to come in OBGY. And this is going to be your game changer. OBGY will boost up your rank, is my guarantee. So many students have been following my lectures and they have told me that, sir, thanks to OBGY, I have been able to boost up my score and you will get the maximum marks in OBGY. When you walk out of a NEET PG examination, you will message me and tell me, thank you, sir, among all 19 subjects, my best performance is in OBGY. And PSM, again, as you can see, around roughly 15 to 20 MCQs. So if you see, my dear students, almost your 50%, if you say 25, 25, 20, 20, almost your 80 to, even if you see on the lesser side, almost 80 to 100 means 50%. Okay, 45 to 50% of your paper, if not at least 40%, is this big four subjects. So we are going to give them 8 days each. 8 days each you will give to these big four subjects: medicine, surgery, OBGY, PSM. 8 days each. And my dear student, you will be saving 3 days. Entire OBGY you will master in just 5 days is my guarantee. You will save 3 more days which you can give to some other difficult subjects of your whichever you find it difficult of your choice. Then comes the core subjects, which are your pathology, pharmac, micro. Again, the second most important, because here again you can expect at least 10 questions or even more. So there we are going to give 7 days. Then your basic subjects. Luckily, anat, physio, biochemistry is volatile. It is boring, but luckily the weightage is becoming lesser. We had a time when there were 300 marks paper, 15 questions. Now hardly 7 questions are going to come in anat, physio and biochemistry. So 5 days is good enough. Do not forget this scoring subjects. They are very important. Radiology, ENT, forensic, ophthalmology, pediatrics. This is a bunch of scoring subjects. 3 days each should be good enough. Of course, please feel free to adjust. This is just a rough guidance. You can give few days here and there. You can interchange as per your weakness and as per your struggling, whichever you are focusing. So you may want to give a few days more to surgery or PSM and less days to ophthalmo, forensic, all that you can do. But overall, if you see radiology, 2-3 days good enough. ENT, 2-3 days are absolutely good enough. Ophthalmology, 2-3 days. Forensic, peds also 3 days, more than enough. So this is very scoring. And finally, the short subjects, hardly 1-1-2-2 MCQ generally come from it. 2-4-6-8, 2-4-6-8, 8 to 10 MCQs will be coming from this final short 4 subjects. So 1 day each or overall 4 days you can give to this short subjects. Okay, so focus obviously should be on these subjects because these are going to get you the maximum marks. Medicine, surgery, OBGY, PSM, at least 80 questions are going to come. Noted. Pathology around 10, 15, around another almost till 130 you will reach only 130 you will reach it only with this. And at physio biochemistry is going to be 15 around, so you reach around 150, and here you may get around 5, 6 of course. So 1, 2, 3 for 130, and then last wala is another around 2 to 3 questions wo iska hisab se. So this distribution of marks is absolutely based on the weightage of the MCQ. Please understand, we are not going to look at the subject, sir. It is such a huge subject, that is fine, but everything depends on the weightage of the MCQs. Yes, sir, anat, physio, biochemistry is very huge, but weightage wise marks are lesser. Okay, similarly, medicine is huge, but you have to focus it as per your weightage. Okay, now, so 87 days, core concepts, detailed lectures, detailed notes, make the concept stronger, and 3 grand tests is what you will give. Now, please understand this. The mistake which students make is that they directly focus with medicine and do not start medicine directly. Please understand this, that I'm coming to the previous slide in a minute. Only do not directly do medicine. Medicine shortcut also I will tell you. Please understand this, that first, please you will do patho, micro, pharmac and radiology. Please understand this, my dear students. Only once you have done this, your 70% medicine is over. So only when patho, micro, pharma and radio is done, and preferably even physiology, your 75% medicine is done, and finish these first. You need to finish these first before you start medicine, and then only you will tackle medicine. Is this understood to all of you, my dear student? Medicine shortcut also I will tell you in just next 5 minutes. So please finish off your patho, micro, pharma, radio, physiology, and then only you will proceed to medicine. Now that is what you will see over here also. So again the first 90 days, as I have told you, the timetable, this 90 days is make or break. This 90 days is going to decide the rank, and that is the rank decider. Is this understood to all of you? So, as I said, PSM, and always mix and merge. That means do not continuously. The mantra is what? Mix and merge. What is the meaning of mix and merge? Okay, sir, do not do only one subject. Because if you keep on doing only one subject, you are going to get bored. That means when I say, okay, patho 7, don't keep on doing 7 days patho. No. Is it clear to all of you? What are you going to do? So you are going to mix and merge. That means, sir, half day. half day or one day do patho, then next day do PSM, then again come to patho, then do OBGY, like that. So mix and merge and start with 3 to 4 subjects. So you start with 3 to 4 subjects and those 4 subjects could be these 4: pathology, PSM, radio, OBGY. That means what you will do: one day do OBGY, then one day half day do radio, then again one entire day do PSM, then one day do patho, then again do half day radio, half day OBGY, like that. Mix and merge. Okay. Now, my dear student, this OBGY 8 days you can easily master. You can master it only in 5 days through my lectures, which I'm going to tell you about it in lesser time, and you are going to save 3 days which you can give to other difficult subjects. When this is over, then go to ophthalmology and then you start your surgical also. So this distribution is on the weightage and on the order which I told you, and then of course micro, pharma, physio, surgery also. Is this clear? And then you can see, okay, sir, then only I am starting the medicine. So medicine starts only when your patho, radio, micro, pharma, physio is over. And then of course with it your medicine. And why anat, physio, biochemistry, anat, bio, because they are volatile, so I kept it towards the ending part. Okay, then forensic, pediatrics, and your short subjects, and remaining part of medicine and ENT. So these are short. So we are going to mix and merge is the mantra. And then first 30 days ke baad, almost after 30-40 days, give a grand test. And then in the next 30 days, you are going to give 2 grand tests. Is it clear? So overall 3 grand tests, 87 days to study, 90-day core concept. Start following that and you will see improvement in your score is my guarantee. So इस तरह से आप follow करोगे. And as I said, patho, micro, pharma, radio finished, and then only start the medicine. Phase 2. The phase 2, which is the next 2 months, we are going to do, as I told you, the revision 1. The first revision, it will be your first revision, and we are going to give 4 grand test analysis. I'm going to tell you focus will be on PYQs and not only NEET PG. Please understand this. INI, CET, PYQs also very, very important. If not of the last 10 years, at least last 7 to 8 years, you should. And try to do MCQs with detailed explanation. What answer you are very confident and what answer you already know, you can skip. But otherwise, when you solve this MCQs also, I'm talking of the phase 2, you should also read. You should also quickly read the explanation also, so that other things get covered also. What you are very sure and you know the concept, that you don't know, but weaker topics ka explanation in detail. And as I said, okay, from this MCQs, you will know which are your weak topics. That weaker topics ka theoretical part also you will have to revise 25% of the time. I have told you. So phase 2 is going to be 75% of your time dedicated to MCQs and 25% time will be theory concepts. This theory will be decided by which are your weaker MCQs. Weaker MCQs, those concepts which you don't know that you are going to do. Is it clear to all of you? And the final phase, of course, we are going to be there throughout your journey, and you can WhatsApp me on this number and call me also on this number. The final 30-day we are going to give to the second revision, which is revision 2 4 grand test. Here you are going to focus absolutely. Then there will be no time of theory, only MCQ based. Only MCQs, most repeated topic MCQs, all subjects, images and clinical case scenarios you will focus on in the last 1 month. So if you know from this, my dear students, what is the whole crux of this summary is that the theory part you're only going to get in the first phase, and that's why the first phase decides your rank, because I keep on repeating it is hashtag crystal clear concept. So more theory part you do in the first, because MCQ is nothing but a way of asking theory. Only if your theory is strong, you can crack any MCQs. Okay, is it understood to all of you? Now, very important. The mistake student make is grand test given, that's it. No, you need to how to boost your grand test score and how to boost your actual score. You will give the grand test properly as per the exam setting and all the timings. Only you give the grand test. After the grand test is over, what do? No. It's not that you go for a movie and relax. No, of course, you take a small break, but then you need to analyze the grand test and see whatever. Sir, 130 correct, that is fine. 120 correct, but 80 wrong, 70 wrong. Which are your mistakes? You need to analyze your mistakes, and I am giving you this very nice ARC. What is this ARC analysis? ARC analysis means what? Okay, sir, A is the attention failure. Attention failure means what? Okay, sir, I was knowing. I know the answer, but it is a silly mistake because I didn't read the question correctly. That means what? Okay, sir, it was except, all except, which is not the this. So you didn't read all our contraindication, all our indication. You made a mistake in reading the question. It was a silly mistake. Those are all except. You didn't read the entire MCQ correct, or you didn't read something in the pregnancy ka weeks of gestation. You didn't read. So you know the concept, but it was a silly mistake. Here only your focus, calmness, and reading the question again, and that can improve with this. So be overall, yes, you should be sad that you made a mistake, but be happy that at least you know the answer and it was a silly mistake, and you do not repeat these mistakes. Do not repeat this. The next is the recall failure. Recall failure means what? That, sir, I have read it, but I am not able to remember. Majority questions are going to, majority of your errors will fall in this recall. Recall failure ke liye what you are going to do immediately, whatever you can't remember. So from analysis, immediately make a book. Make a book of your errors. Remember this, write it, make a sticky note, stick it on your bed. Some things, sir, which is I don't able to remember, I'm not able to remember. Write a sticky note, stick it on your in your study table every day, 5 minutes, 10 minutes before going to sleep. Read those mistakes, or read those, keep on revising this, or make a book. You can make a book of error. Make a book of all your errors and mistake, which will then become your success story. Clap if you have like this. Okay, your book of error. That means all the mistakes which you're going to make of all 19 subjects. One common book. Whichever mistake you made, keep on writing it, and then keep on reading, and that book of error will finally, my dear student, become your success story. Thoko tali. Okay, so silly mistakes, okay, be happy, but do not repeat them. Recall failure, immediately make a note in this notebook or a sticky note, and you will try to revise again and again so that recall mein problem nahi hoga. And most dangerous, my dear student, the C, concept failure. These are the most dangerous. Why? Because sir, concept hi nahi pata hai. I do not know the concept only. So these are the most dangerous. And this, my dear student, only you yourself can help yourself. मतलब कि you will have to put in effort. The concept failure जो है, the concept failures, that means, sir, the question came, this MCQ came, and I do not know what is the concept only. Example, ectopic pregnancy, when to give medical, when to do surgery. This concept only I do not know. I'm talking of all subjects. So here, why are they most dangerous? Because unless you improve your concept, your score will not improve. So attention failure, attention mistake हो गया, recall mistake हो गया, and concept. This concept के लिए क्या करना है? Yes, only one thing, theory. Open your book again, open your notes again, go back and see those videos, and you will have to read in detail. You will have to read about these concepts, then only your concept will improve. Is it clear? So you will get 10, 15, 20, 30 questions in your analysis, which, sir, I do not know this concept only. Then what is the option? Yes, go back to the videos, go back to the detailed notes, go back to the main concepts, build up your concept, then only, otherwise same concept MCQ. You will see a pattern. When you give 3-4 grand tests, you will know that these are your weak topics, these are your strong topics. Always there's a pattern. You always fall in the same trap. Okay, so I hope all of you will make analysis of this ARC, which is your attention, recall, and concept gap, and improve and make a book of errors which will become your success story. Is this clear? So keep on making flashcards, as I said. Keep on making your flashcards, and you will make a diary, as I already told you, for your attention, and this, for which is the same thing, flashcard or diary or the book of error, which I told you, and keep on revising them in the phase 2 and phase 3 so that your score is going to boost up. Now, my dear student, medicine is very huge, and many students tell me, okay, sir, please give us some shortcut for medicine, something please tell us for medicine. So this is based on my years of experience and based on what the question paper has been there in last 8 to 10 years. Focus on these first. Cardiology, when you look at ECG, myocardial infarction, rheumatic heart disease, infective endocarditis, heart failure, minimum. Stroke, epilepsy, meningitis in neurology, tuberculosis, absolutely, COPD, pneumonia, ABG analysis, again very important. Surely questions come. Rheumatology, SLE, and RA. These are the main. This too you have to do, must know. And I said only medicine you start after you are over with patho, micro, pharma, and physio and radio. Then if time permitting, more systems, endocrinology, diabetes, at least, and other things, nephrology, acute and chronic renal diseases, infectious diseases, malaria, dengue questions are also going to come. Okay, so this is the bare minimum. This is the shortcut for medicine. At least do this, and I'm sure your 70 to 80% medicine will be these questions. Surely, out of 20-25 question medicine, your 15 questions are going to be this only. So at least itna bhi aap kar loge, you're going to get a good boost in your medicine. And my dear student, OBGY is going to be your game changer and rank deciding subject is my guarantee. OBGY will become your most favorite subject, most scoring subject, because it's a absolutely fixed pattern. In my app, download the OGGuru app. I also given the list of important topics and just dedicate 5 days. My dear students, the single most important subject you can understand. If with your current knowledge, you are getting 10, 11, 12, 13 MCQs correct in OBGY. After my video lecture, just give 5 days to me on my app and your score is going to boost up and your score is going to come to 18, 19, 20 and 4 to 5 MCQs more. 20 marks is the difference between rank of 4,000 and 40,000 or a rank of 400 and 5,000. Is this understood to all of you? So many students who have not done well in previous 1-2 attempts also, and in the then they take the app and this ranks were in 70, 80,000. The rank has jumped up under 6 months my guidance and the rank has jumped up to under 1,000 also. So it's the highest return on OBGY is we are going to get. It's very predictable and I have absolutely a master class, and therefore you master OBGY with me. We are going to have detailed MCQ discussion videos, all your PYQs. You will become most confident OBGY. Students have told me, sir, we were mugging up OBGY. We used to hate OBGY. What is actual OBGY and the concept? You made us fall in love with OBGY. So it's a single most important subject. 20 questions surely are going to come. You can go and check my YouTube videos also. All previous 20 questions directly all from my notes. So please go for the master class. It's just 1750. I'll tell about it more in a minute and you can see that the score is going to jump up. So launch 30 is the discount coupon code. What are we going to give you? We are going to get conceptual theory lectures, all the MCQs, all the PYQs of not only NEET PG, INI, CET, FMG, all the PYQs, beautiful handwritten notes, mock tests, and of course my personalized timetable guidance. You can directly call me also. And the 6 months masterclass is available only in 1750, my dear students. So what are you waiting for? Download the OGGuru app and exactly 45 hours. That's it. 42 to 45 hours. I'm surely all of you are going to study. You're going to study around 8 to 9 hours daily. So exactly as I said, exactly in 5 days, there are students who have been putting 10 hours and in 4.5 to 5 days, you can finish off and master entire OBGY. I will give you much more time for other difficult subjects like medicine, surgery, PS. In fact, what I tell my students, don't do continuously 5 days. Just do 2 hours daily. 2 hours daily you can do OBGY, and those entire 8 days of OBGY which I told you can dedicate to some other subject. Okay, you can just do this, that you can just directly do 2 hours daily. 2 hours daily from my app, and this entire 8 days of OBGY you can distribute to other subjects, and you will be, students tell me that, sir, when you have added so much humor, it's like Netflix and chill. When we are bored of other subjects, we come and see your videos. So entire day see other videos, and directly in the evening time or any time, just dedicate 2 hours to my app and you will see the improvement in your score is my guarantee. See this beautiful handwritten notes which I'm going to show you, absolutely color and integrated. And students have told me we have got a notes reading session also, and students have told me, sir, once we have seen your videos, entire notes we can revise in 2 to 3 hours is my guarantee. And please see this. There are many more. There's just a few things. Sir, OBGY absolutely makhan. All concept from your notes and lectures. We really wish you had taught us all the 19 subjects. So all questions from, if you can revise your book, and almost all the questions. It's a great thing. And sir, your revision helped me. Questions came the way you really taught us. Okay, OBGY, most important overall exam OBGY were from your videos. Okay, my dear students, so we are there to always help you out. Download the OGGuru app, anything else. And the last 2 points, okay, follow on Insta and subscribe to the YouTube channel for many more interesting videos. And the last thing which I want to tell you before we wind up is that, my dear student, also pay attention to your health, mental and physical health also. So take good breaks. I'm not telling you to remain awake. You will take good rest also. You will sleep well. You can take rest for 6 to 7 hours overall also. In spite of that, you can easily get 12 hours to 10 to 12 hours of study also. And always give 5, 10, 15, 20 minutes for your yoga, meditation, exercise, mental health also. So relaxation techniques, yoga se hoga. okay, yoga and all that, meditation, and absolutely power of positive thinking. 5 minutes, 2 minutes before you go to bed, power of positive thinking. Absolutely, you need to stay positive. And what you will do is imagination. You are going to imagine yourself entering the examination hall. Imagine that all the questions I am getting correct. Imagine yourself coming out of the examination hall and jumping with joy, and imagine yourself getting a dream branch and your dream college and a beautiful rank and an excellent score and a rank. And imagine yourself doing the residency already, and also imagine yourself that your PG is over and now you become a big consultant or a big surgeon or whichever. Okay, so every day, 5 minutes, 3 minutes before sleeping, just keep on thinking this positively. Okay, this will happen with me, this will happen with me, and it will happen with you. So put in a lot of hard work, put in a lot of efforts. Pull up your socks. I'm there to help you for your guidance and timetable and any strategy what you want. And every day, apart from your good rest and exercise and yoga, 5 minutes time on positive thinking. Keep on thinking. Imagine yourself that I am getting excellent rank. Imagine that all your hard work is going to pay, and imagine yourself getting your dream branch and dream college. And of course, my dear student, follow us on Insta and YouTube. Get free feel to get in touch with me on phone, WhatsApp on this number. Download the OGGuru app, and OBGY will become your most favorite subject, most scoring subject, is my guarantee. So just wishing you all the best for the NEET PG examination. You will make it. You will do it. Best of luck.